one of the things that is really important to me about our community is that when we have this conversation, we don't diminish the value of life. That, the tradition is so invested in the preservation of the life of the mother, whether it's mental issues or physical issues, but it also deeply cares about the value of bringing children into the world. And so as religious people, if we're holding up the questions of reproductive rights, we don't want to seem as if we diminish life in the process. So as we continue to have this conversation and as we think about how we want to be involved, I think it's really important in our community and how we speak about these issues that our commitment to the value of women's life and the honoring of our choices is not a diminishment of any other life. And that feels really important as religious voices coming to the conversation. So that being said, we're really, really happy. After I spoke about this in services a number of weeks ago, there was like a desire, like, what are we going to do? What are we going to do? And Kiana Davis, who is I always forget your actual title, who's really our justice leader in terms of our staff, and I put our heads together and in doing research that particularly Kiana took the lead on. The work is already being done, and it didn't make sense to reinvent the wheel, but actually to join efforts with the Jewish community and the multi-faith community around how to get involved. And the National Council of Jewish Women, which has been working on these issues for forever, had launched a new campaign called 73 Forward, and just had hired some really fabulous folks. So we're really excited tonight to hear from the co-chairs of this new campaign called NCJW National 73 Forward, Glenn Northern and Shira Zemel, who just joined the staff of NCJW like a month ago, right? Which is awesome, but they know these issues deep and well. And we're also very blessed to have our the NCJW New York Director of Advocacy and Volunteer Engagement, Aviva Zadoff, because we know that in general, as a community, when we're working on advocacy, we know there are local issues as well as national, and our power is actually often more powerful in the local. So we didn't want to only focus on the national, but we also wanted to give voice to the local issues. So the hope for this evening is to hear what's going on and then to think about how we can be involved, what we as a Jewish community, as BJ, would like to do. So what Glenn and Shira and Aviva are going to speak to what NCJW is doing nationally and locally. We're going to ask folks to put their questions in the chat, but they will wait until the end of their sharing presentation until they respond to the chat. So either you can hold on those questions because there will be a time for Q&A at the end of their presentation, which should last about like 20-25 minutes or so. So just to give folks a sense of the evening, they'll speak for about 20-25 minutes, then there'll be time for Q&A, and then Kiana will lead us into some breakout rooms about how we can be involved and what we're inspired about, and then we'll conclude out with some report backs and closing. So Glenn, Shira, and Aviva, welcome and thank you for being with us.
Thank you so much, Rabbi Sol. This is, as Rabbi Sol said, Shira and I are super thrilled to be with you here today, and also with Aviva sort of delivering this. And I'm just going to start right off. So really 73 Forward is about galvanizing the Jewish community around abortion access and figuring out how to increase abortion access and doing it Jewishly. First, next slide, please. I'm going to talk a little, the problem really is the volume of anti-choice, anti-abortion legislation has increased exponentially the last several years. In fact, in the last 5 years, more restrictive legislation, well, more than a quarter of all the legislation that's ever been restrictive legislation that's ever been passed on anti-abortion legislation has been passed in the last 5 years. So it's really on an exponential curve. And 2022 is looking even worse. So many folks have probably heard of a couple of the really high profile cases that are in the news at the moment. We have SB 8 in Texas, which is a really cruel and pretty awful piece of legislation. Texas SB 8 really deputizes a number of the regular citizens to turn in their neighbors for helping with an abortion or getting an abortion, and really sets the folks that are getting an abortion apart, isolates them from their community, from their clergy, from their families. And then it actually even incentivizes that by, if the lawsuit is actually successful, the individual who did the suing gets $10,000. And it's also the case that actual mechanism, because instead, and usually the state is the enforcement piece around this, because it's actually individual citizens that are the enforcers of this, it actually was the piece that allowed the Supreme Court to sort of say, actually, we're not going to, in a sort of procedural motion, we're actually not going to deal with this, instead of enjoining it as they typically do. The other big case is really the Dobbs versus Jackson Women's Health Organization. Jackson Women's Health Organization is the last clinic in Mississippi. This is a 15-week ban. The Texas SB 8 is actually a 6-week ban, which frankly is before most people even recognize that they're pregnant, because they measure it from the last menstrual period. So it may take you a little bit to even figure out that you're pregnant. But so Dobbs is actually a 15-week ban. This is the case that was just heard before the Supreme Court oral arguments 2 weeks ago on December 1st. And it is a true blue constitutional challenge to Roe versus Wade, which has been in place for the last, since 1973, because it would dissemble the framework, the trimester framework that we have, that's been in place for more than, for close to 50 years. And frankly, the justices' line of questioning in this is incredibly troublesome. And we expect that we will, come June, which is when the decision is likely to be made. I mean, it can be made at any point in the beginning of next year, but usually for these really high profile cases, they wait till June. We expect that we will lose. And as a consequence of that, next slide, there will be, this map really shows the abortion deserts that will exist. The orange are the swaths of the country where where abortion will either be banned or where there's not any clinics left standing anymore. As you can see, New York actually is one of the places where folks will be able to get access, which means that there will be many more folks coming into New York from surrounding states, Michigan, Indiana, Ohio, West Virginia, sort of moving either into Pennsylvania or into New York to acquire the abortions that they need. But it's a pretty grim picture.
A very grim picture. Thank you, Glenn. The numbers really speak for themselves. We've lifted up a few here. 58% of American women 13 to 44 live somewhere hostile to abortion rights. As Glenn mentioned, there's been 1,300 restrictions that have been passed by states since Roe. The cost of first trimester abortion care is really wide ranging and for most folks out of reach and inaccessible. And like the numbers are staggering of the amount of people who will not be able to access care if Roe's overturned is staggering. So how did we get here? there's been an unrelenting anti-abortion agenda from the religious right that created a very Christian-centric, negative cultural narrative around religion and abortion. There's been, since, as Glenn mentioned, in the last many years, like lots of anti-abortion pushes for bans, both on the individual seeking care, but now, as Glenn spoke to, like those who are there to help those seeking care. And then also, another really important piece of this is that early work to expand abortion rights, there were some mistakes that were made early on as the movement was really building, particularly like a compounding problem around issues of access to abortion and sometimes excluding BIPOC, Black, Indigenous people of color, LGBTQ folks, and other marginalized groups. And so this is how we got here. We need to hold this as we move forward. We should also hold, as Rabbi Sol spoke to at the beginning of the call, like this is very much a Jewish issue. And, the most fundamental text underlying our understanding of abortion, one of them is in the book of Exodus, describing a case in which someone inadvertently causes a miscarriage. The Torah specifies that the guilty party would be liable for manslaughter only if the pregnant person themselves dies. Otherwise, they would pay monetary damages as the fetus is not regarded as a person. Our tradition is clear, as we talked about at the beginning of the call, that abortion is required when the life of the pregnant person's at risk, and through the duration of the pregnancy. There's rabbinic literature that I just started to study as I came onto this role around like this idea of until the head emerges in the birthing process. That there's some rabbinic literature that's the definition of the like cutoff time, and that basically this idea that abortion is considered a form of self-defense in some cases if the life of the mother is at stake. And so while the overwhelming public narrative of faith and abortion focuses on the belief that religious groups restrict abortion access, we as Jews have an obligation to share, a different perspective, and that it's not in spite of our religion that we work on this, but because of it, and lifting up the importance of, life too. I really heard that at the beginning of the call. Absolutely. So we have to hold so much. The landscape's not good. This is a Jewish issue. This is, there's a lot of reasons why we got to this point, but we're ready to move forward. We need to move forward, which is why we want to double down as people of faith. And we're determined to work. We want to mobilize the entire Jewish community so that we are represented, educated, and empowered to change this narrative while supporting the reproductive justice movement and centering those who are blocked from accessing care.
So I saw in the chat sort of, they wanted somebody who wanted to approach this from a reproductive justice framework. Yay. So I'm going to talk a little bit about what is abortion justice. So it's really the idea that we put at the center of the analysis, we put at the center of the way we think about policy, the folks who are most impacted. So Black, Indigenous people of color communities, LGBTQ communities, immigrant communities. It's really the folks whose identities compound the challenges they have towards abortion access, frankly. And so that is really the lens through which we want to do this work. The second really important lens is the religious freedom lens. Religious freedom is an absolutely fundamental freedom. Yet increasingly, we've seen the opposition really weaponize religion to get their way, whether it's Hobby Lobby or other sort of overly broad religious exemptions that allow corporations, hospitals, other entities to, trample on, steamroll the rights and health of individuals. And SB 8 and the Mississippi 15-week ban are just further examples of violations of religious freedom, because as Shira was just saying, and as Rabbi Sol said earlier, that does not comport with sort of Judaic law around this. It really is a violation when the state is sort of, it's a violation of separation of church and state. I was literally talking to a Jewish doctor just yesterday about a situation in which his hands were actually tied with regard to this, and regard to a situation that he was in, and how awful it felt, both as a doctor knowing, what sort of practice he wanted to engage in, and also, as a person of faith, how his hands also felt tied. It's just simply wrong and frankly immoral.
So yeah, so now like we're holding with us an abortion justice lens and a religious freedom lens. And these are important ways for us to look at the work that lies ahead. And so now we want to just start to spend some time about so what do we do, and start to piece through, all of that. And we want to provide some information and tools and thoughts around how we're thinking about this. So I want to take a moment to talk about language evolution. And many of you may know this famous quote, Ludwig Wittgenstein, who was a 20th century philosopher, Jewish philosopher of language, said, "The limits of my language means the limits of my world." And, language is everything. And, I don't need to tell all of you that language it's everything. And so language can be extremely limiting when you can't find the right word to express how you feel. I just taught my son the word skited, which is a made up word. It's a combination of scared and excited, because he was saying that he was scared for his concert, but I knew he was looking forward to it. So I was like, skited. I actually got it from podcasts, but anyways, so, sometimes we don't have the language we need to express ourselves, and, language is constantly evolving and all of that. So we're going to talk for a moment about language around abortion justice. I'm going to get a little bit specific. Some of this might feel uncomfortable. Some of this might feel different than the way you speak about these issues. And that's totally okay. Welcome that, this is an opportunity to evolve the way we think about things and talk about things. So some of this might be new. Many of you might be already thinking about it this way. But with that, let's take a look at how language in this work is evolving over time. So in the 1970s, the birth of a lot of this work, my body, my choice, or pro-choice were really the slogans and what we hear as folks talk about it. And as it's evolved, we hear people say pro-abortion or pro-abortion access. So what's the challenge with the word choice is that for so many folks, this isn't a matter of choice. For many folks, it's a matter of access. They've made the choice. They now need to access the care that they need. Or for many, it's not a matter of choice and the life of the pregnant person's at stake. Whatever the issue is, this has evolved into being an access issue and less about choice. In the 90s, very, safe, rare, and legal became the way many folks spoke about this. That's evolved. Support abortion access, end of sentence. We don't need to qualify it. We're supporting abortion access. More recently, we hear reproductive freedom, reproductive health, rights, and justice. This is still language that we're using at different times for sure, but this has also evolved into abortion justice, and we are taking cues from, again, centering the folks who are most impacted and are leading the work, our allies, and our partners across lines of difference. And that's the framework that they have set up, abortion justice. And so we are also going to work within that framework as well. And then I also want to say a word about the word woman in this context. That word has evolved too. People who can get pregnant, you might hear us say people who can get pregnant, people who have abortions. And, I note that although the majority of abortions that are provided are to people who identify as women, people who do not, such as trans men or non-binary folks, can also experience pregnancy and abortion. So sometimes we will say people who can get pregnant, and that is another note about language as well. Glenn.
So it's not that often that we get good news in this work around these issues. And today we got some good news. Hooray! So this is breaking. I think the story probably broke within the last hour. So we're revamping the slide literally as we sort of came in here. It's about medication abortion. So one of the really important avenues for accessing abortion, increasingly so. In fact, more than 40% of the abortions that take place in the country right now in the first 8 weeks are done by medication abortion. And that number has been going up steadily, even as the number of abortions overall in the country has been going down. It is incredibly safe and it is incredibly effective, but it is also overly regulated. And today, the FDA basically is allowing the rules that have been in place during COVID to stay in place. And these rules during COVID were basically folks could access abortion pills by mail because, frankly, it was more dangerous to go into doctors' offices. And it's just good practice because we don't know as many regulations as exist around medication abortion. Because it is abortion, it has been, it's subject to all kinds of, regulations that abortion provide, call them trap laws in some ways, but it's really unduly regulated in ways that it needs not to be. But today we got good news, and what's been in place during COVID will be actually allowed to continue forward. And the hope of 73 Forward really is to push even further around making sure that medication abortion is accessible to folks all over the country.
So in a moment, we're going to hand it over to our colleague Aviva to share about how you can get involved in this work in a local NCJW New York campaign. Really excited to hear about. And we are going to take questions in a little bit and talk about actions and next steps that each of you could take, or BJ as a community could take. But yeah, hopefully you have a sense now of the principles of this campaign that NCJW has just recently launched. And the goal of 73 Forward is simple. We want to share a clear collective Jewish framework to increase on the ground access to abortion care for anyone who needs it. And there's lots of immediate paths forward, and those are evolving every minute as the landscape continues to change. And we'll share more about next steps after we hear from Aviva and take any questions. Aviva, I'm gonna hand it to you.
Great, thank you. So I am going to speak, as Shira said, a little bit about what's happening here in New York with NCJW in the reproductive rights and justice work. So just for a little context, NCJW New York is the local NCJW section here in New York City, and we do a combination of direct service and advocacy work. We've been involved with work on reproductive rights and justice for decades. And over 2 years ago, we launched something called our Pro-Truth campaign, which is an education and advocacy campaign focused on exposing the truth about crisis pregnancy centers, which are also known as fake abortion clinics. Next slide, please. So a crisis pregnancy center, or sometimes they're called limited service pregnancy centers in laws, is a facility set up by anti-abortion activists whose goal is to provide anti-choice counseling in an effort to discourage people who are or think they might be pregnant from having an abortion. They use names that sound like real health clinics. They have exam rooms with equipment and workers wearing medical scrubs or white coats. And these fake clinics mislead people into thinking they're real full-service reproductive health care providers, but often they're not licensed to provide any medical care, or sometimes at the most very limited care. And fake clinics are really the service arm of the anti-choice movement and exist solely to convince pregnant people that they should not terminate their pregnancy. And they go as far as to lie and scare people when necessary to achieve their goal. Next slide. So Pro-Truth is a coalition effort led by NCJW New York, bringing together advocates, community-based organizations, providers, and lawmakers. And so our goals are to educate and advocate around the issue of CPCs. So we work to educate at-risk people to inform them that these fake clinics exist, so they can protect themselves and their peers from falling victims unwittingly to this deceptive tactics. And we partner and work with organizations who work directly with the communities because they have connections and trust in the communities that we don't necessarily have. Next slide. We decided to launch Pro-Truth because many people don't know what a crisis pregnancy center is. And if they do, they don't know that they exist here in New York. In New York City, we have over a dozen crisis pregnancy centers, and across the state, we've identified over 120 of these centers. And they're here the same way that they're everywhere. And we wanted to do something to bring awareness to this issue. So this map shows the crisis pregnancy centers all around the state of New York. And you could find it at our website, protruthny.org, where it's actually interactive and you could see the clinics across the state. And I prepared a couple slides to show you some of the tactics of fake clinics and how they try to deceive people. So if we could go to the next slide. We have two clinics here. One of them is real, one of them is fake. So just take a second to look at them, think which would be the real one, which would be the fake one. And the truth is that the fake one is, the one on the left. So here they are sort of, being really loud and trying to attract people, while a real clinic, for the most part, they try to be unassuming because they don't want to attract unwanted attention and they want people to be safe coming to their facility. Next slide. Okay, we have two clinics side by side. They both have the name Choices in them. One of them is real, one of them is a fake clinic. So think about which one looks real, which one might be fake. And we can reveal the one on the left is actually fake. But if you are somebody looking for a abortion, if you are looking for reproductive health services, it can get really confusing when they use names like Choices or have pregnancy or health clinic in their names. And then finally, we have two websites of clinics. And you could see one is real, one is fake. They both have very similar looks and tones to them. I know you can't read the words because of pictures, but anyway, we could reveal that the one on the right is the fake one and the one on the left is the real one. So you could see how deceptive they are, how much they try to look like real clinics, and how hard it could be if you're trying to access real services. Next slide, please. We also advocate and push for legislation and policy changes to address the harms done by CPCs. We're not looking to shut these places down. Everybody should be able to get the care they want, but we think that these places need to be transparent about their services and should be regulated and overseen by appropriate government agencies. And we're currently working on a piece of legislation that would create a study bill, and it would require the New York State Department of Health to conduct a study of limited service pregnancy centers, because there's so much we don't know about what's happening in these places and how they operate. There's so much secrecy around these places, and this bill would help us gather information to know how they're financed, what's happening in these facilities, and what the demographics are of these clients, who they're actually serving. And we feel it's really important to have a government agency without an agenda come in to do this fact finding. And this coming year, we're going to be asking the state legislature to support this important piece of bill. And with that, I will hand it back.
So we thought we would open up to some questions. We presented a lot of wide-ranging information before we share with you how you can get involved with these campaigns. We can also start to preview that as folks are thinking of questions, but is there any questions off the bat, Kiana? I'm gonna leave it to you to facilitate us.
In the chat, that's that nearly 20 states have a law that requires physicians to physically give pills to women for medication abortion. Will the FDA's ruling override these laws? And also, what about incomplete abortions? A small proportion of Medicaid abortions do not result in full termination. So will women in high restriction states have access to surgical procedures in those cases? It's a multi-part question.
That's a fantastic question, Deborah, really sharp. And actually, and Ellen started to answer in the right underneath you. And yeah, so the short is exactly that. It lifts the rules that were in place during COVID. So it doesn't override individual state laws around these pieces. Like, and one of the new frontiers that we're going to have to be fighting on is the fact that states are already beginning to execute bans around medication abortion. Like, so not only does Texas have its 6-week ban, but right after that, they passed a ban on medication abortion. So that is a frontier that we will also be fighting on. And then the second part of this, a small proportion of abortions do not result in full termination. That is true. Will women in high restriction states have access to surgical procedures in those cases? I think that has to be answered on a state by state cases. Like if you are in a state where
Ellen has a helpful response here around I'm going to read it if folks aren't seeing in the chat. It is malpractice for a doctor to not provide surgical follow-up to those in need after incomplete abortions, though we're worried that restricted access will continue and folks will find ways to block those things, even still.
So does that answer your question, Deborah? Sorry, you can only hold so many people on your screen at one time.
She's giving a thumbs up. So you're
good.
So you're good. We don't have other questions in the chat. So if you all want to share some ways to be involved, and then we're going to do just some short breakout rooms for people to do a little bit of reflecting and sharing.
Okay, I did see one other hand raised at one point. So if that person wants to, they can unmute or whatever, but we'll keep going with ways to get involved, but feel free if there are other questions. Okay. I need to share my screen again. Okay, so we want all of you, both each of you as individuals, but also as a community, to join us. So 734.org, protruthy.org, those are our campaign websites. Those are constantly being updated to have the most, up-to-date ways that we are mobilizing folks and following us on social media as well. So we want you to join us. That's where you can find out our actions and all of the good information. We're going to be in touch. We're going to get Kiana everything to send you all an email tomorrow with this information that we shared, the deck, all of that good stuff. But we hope you'll join us. And we will be successful if we have this is a Jewish movement mobilizing for abortion access. Can we reclaim the narrative and be loud and proud in the public square that as Jews, we work on this issue? So there's different ways to take action. Again, we want to reclaim the narrative, right? There's not one faith-based approach to how we think about this issue. And so for the Jewish community to reclaim the narrative, we need to do it together across the country. Repro Shabbat happens each year for Parshat Mishpatim, for the Parsha in Exodus, where I was referencing earlier, that's coming up January 28th, 29th. We're looking for Jewish communities across the country to take part in Repro Shabbat. So perhaps there's some folks who want to think about how your community could be involved, or Shabbat dinners where you could bring this into your, honor our commitment to this work as part of our Shabbat practice. Host a courageous conversation. We have courageous conversation guides on the 73 Forward website. The way that we start to make cultural change is to destigmatize these conversations and to create space for people to share their abortion stories and to share their reproductive health journeys, and to make it create space where people can feel comfortable talking about these and talking about these things and trying on new language and all of it. So we have guides for you to host these kinds of conversations, whether that's with your book group or with your chavruta in the congregation. We have guides that can facilitate meaningful conversations to help bring these conversations out into the light. We are going to be mobilizing folks to get loud and stay loud, and using channels to educate and mobilize our communities. So that's why we want you to join our channels, because, really being out there and not giving up the drumbeat. We know the right never gives up their drumbeat. They are on it, out there every single day. And we want to do that as well. We're looking for Congress to take action and pass the Women's Health Protection Act. I saw well taken earlier in the chat. I saw, as New Yorkers, that doesn't feel so impactful right now, and I get it. Joining Pro-Truth is like a really great way to take action locally. So we're going to share via Kiana, get you all this information. We welcome you to be in touch with us anytime. We're building this Jewish movement for abortion access right now. And so we're looking for folks who want to be involved with us, and we welcome ideas. And if there are resources you need, anything, we are here and want to be here with you.
I just want to say just a couple of things before I have to run and jump onto Evening Minyan. Thank you for coming. And I just want to say we've had a history when we started our community organizing work many, many years ago. There was a women's rights chevra. I think some of you who are on this call were a part of it, and thank you for that. We're ready and willing to get moving again. So I just want to kind of note the history, that we have a long history of being engaged on these issues, and also as a community around advocacy work, and also about telling stories in order to make cultural norms shift. So I just want to kind of say we're really ready to engage and organize and be a part of a larger effort and raise our voice, and also educate our community at what's at risk. And I want to thank everyone for participating, and particularly to Aviva, Shira, and Glenn, and also Kiana from our team, who has been so instrumental in making this happen, and look forward to the work ahead. I'm sorry we have to do it, but I look forward to the work ahead. So Shabbat Shalom. I'm going to now hand it off to Kiana. Have a good night, everyone.